this research to the library. You thought I was kidding, but work study. I have keys to the school, so I can go to the library whenever I want. Sweet.
Okay, so I had a little fun there, and I want to be clear, I'm not making light of HIV/AIDS, but you do have to admit that free and open access to a library is the dream. So I've only had a chance to read through the article Eric posted, and it isn't very detailed, and I'm going to try and keep this very simple. So um, it's just a press release type announcement. Even if the drug does work perfectly, we still have months, if not years, away from it being okayed for this use. There's lots of testing and trials. It does talk about how it may get fast-tracked because it's already been approved for human work for the antifungal application, but that doesn't mean that it's market ready for HIV/AIDS treatment. But Eric does have it right that this is something worth shouting about. The drug, and I'm not sure I'm going to pronounce this absolutely correctly, so Sir Lexaprox, Sir Oprixox. I'm going to have to start learning how to pronounce medical or pharmaceutical medication names properly because I'm going to be a nurse very soon. I say very soon, but I'm still like 8 or 9 months away. Is currently a topical antifungal drug which someone must have noticed had a weird effect on HIV patients in that after using the drug they didn't have HIV anymore. Which is pretty awesome. Like, oh, I've got this fungus on my hand, and oh, by the way, I now don't have HIV. I'm going to stay away from calling this a cure for HIV/AIDS, partly because it's far too early to start throwing that around, and also because we've seen this before. We've been promised cures for cancer and HIV/AIDS and things, and then it's turned out that, like, no, not really. It's only a treatment that keeps it, like, in check, or, you know, it only works for, like, 3% of the population, something like that. So, that doesn't mean I'm not optimistic about this potential new treatment for HIV/AIDS, but there are some things I would ask questions about. You know, there's still a lot of details that have to come out about this that haven't yet. So I'm going to be patient, and I'm going to hopefully hear more about this in the coming news. So, the article mentions HIV and eradicating the HIV-1 infection because of the drug, but never says anything about AIDS. Now, one could take a leap and say that because HIV/AIDS is the same virus, HIV-1, that once HIV has compromised your immune system, along with certain other optimistic infections, or your HD4 cell count is below about 350 cells per 3 millimeters. That's a general guideline, which with proper treatment and early detection can take years or even decades to actually get to the point of AIDS. But that's when patients are said to have AIDS. It's not, the disease doesn't transform from one thing to the other, or like the virus doesn't go from being HIV to AIDS. It's more you have the HIV virus, and then after a time it compromises your immune system, and then you get other infections, or your T cell count drops below the 350 level. You're supposed to have between, I believe, 500 and 1,000 cells, but yeah. Anyways, so that was a long digressing rant to point out that although the article doesn't mention it, I suspect the drug would still prove effective even if the patient has transitioned into AIDS. Now, there's still a lot of testing that needs to be done, but one of the promising notes in the article is that it mentions that there is a second drug that may also prove effective in eradicating the HIV-1 virus in a host. And I would like to highlight two major reasons why this is important and wonderful, and admittedly one is more positive than the other, trying to be optimistic. But those are cost and individual patient treatments. So with two potential drugs on the market, if a patient proved to be allergic to one drug, which is very common, a lot of times, they're allergic to one drug and you have to give them a different one to get the same effect. There are certain people who are allergic to certain types of NSAIDs or are allergic to NSAIDs. So you have to give them something else in order to, as a painkiller, to work. Some people are allergic to morphine, whatever. So one of the positive things about that is that if they're allergic to this drug, the antifungal drug, but not to the other one, which I believe is meant for treating patients who have too high of a iron count, iron in their blood, then they can use that one instead. The other thing is that if they try the drug that was originally meant for treating iron, too high of an iron level, and it turns out that the antifungal drug is more effective, then they can go with that. So you have options. It's like, well, I have back pain and Aleve works on it, but ibuprofen, generic brand ibuprofen works better. That kind of thing. I like Coke, but Pepsi is better. I know that's kind of trivializing the whole thing, but that's kind of how that works. So my other point is cost, which is a big point in any discussion about healthcare these days. But if you're a giant pharmaceutical company, and you produce the one and only cure for HIV/AIDS, again, trying to avoid that term right now, but the one and only cure for HIV/AIDS, you're going to charge out the ass for it. And I know that we're supposed to be not using swear words, whatever, but in this context, not speaking well, guys. In this context, it's important. So charging out the ass for it. That's just how business works. I get that. Supply and demand. I have the one thing that you need, so you're going to pay money for it. And they know that. They know that if, you need 100 of these little tablets and then you won't have this life-killing disease anymore, you're going to pay for it. You will sell whatever you need to in order to live, because that's what humans do. We survive. So, I am resisting the urge to editorialize about this, so I'm going to move on. But if there are two drugs in the market, that's competition, and that helps to keep the price down. So Eric, you effectively gave us a challenge earlier this week, and it was up to whoever was willing to jump to it. But no one did. But the week's not up yet, so we still have a couple more days. But anyways, I don't have bubble wrap, so I can't film through bubble wrap. This is the best I've got. So instead, what I'm going to do is give you a 30-second review of the book that I read yesterday, which was Fortunately the Milk, with plastic taped to my face, and I hope that appeases you. So, 30 seconds. Go. So, Fortunately the Milk is a new book written by Neil Gaiman. It's definitely either a children's book or written in the style of a children's book. I really enjoyed the artwork in it. It was a little bit Shel Silverstein, which brought back a lot of memories from childhood. And I thought the writing was great. It's the type of story that I love to make up and just throw out to people and come up with random ideas and excuses. It's a great read. It'll take you maybe an hour to read it. I've already gone over 30 seconds, but it is fantastic, and please, I do suggest reading it. Eric, feel free to challenge me to do something else with plastic and or bubble wrap attached to my face for the next week, and I'll make it up to you that way. All right, thanks, nerds. Bye.